Osteosarcoma, a form of bone cancer, primarily affects the long bones in the body, such as the arms and legs. It is the most common type of primary bone cancer, typically diagnosed in adolescents and young adults between the ages of 10 and 20. Interestingly, it's less frequently seen in older adults, though it can occur in various age groups. The exact causes of osteosarcoma remain unclear, but certain genetic conditions, such as Li-Fraumeni syndrome and hereditary retinoblastoma, may increase the risk. Symptoms often develop over time and can include persistent pain in the affected area, swelling, and a noticeable lump. As the tumor grows, it may cause fractures or limit mobility. Early detection is critical, as osteosarcoma can metastasize, frequently spreading to the lungs or other bones. If you notice persistent pain or swelling, consult a medical professional for evaluation. Diagnosis typically begins with a thorough history and physical examination. Imaging studies, including X-rays, MRIs, and CT scans, are essential for visualizing the tumor's location and size. A definitive diagnosis usually requires a biopsy, where a small sample of the tumor is extracted for laboratory analysis. This helps determine not only the presence of cancer but also its type and grade, which influence treatment options. Managing osteosarcoma often involves a multidisciplinary approach. The cornerstone of treatment is surgery, aimed at removing the tumor and some surrounding healthy tissue. In some cases, limb-sparing surgery can be performed when possible, allowing for greater functionality post-treatment. However, if the tumor is too large or in a complex location, amputation may be necessary. Chemotherapy is another crucial aspect of treatment, employed to shrink the tumor before surgery or eliminate remaining cancer cells afterward. A combination of different chemotherapy drugs is typically used, which can include cisplatin, doxorubicin, and methotrexate. While chemotherapy can be effective, it may come with side effects, such as nausea, fatigue, and an increased risk of infection due to a weakened immune system. Radiation therapy is not commonly used for osteosarcoma due to its resistance to radiation. However, it may be employed in specific situations, such as when the tumor cannot be completely removed surgically. The prognosis for osteosarcoma varies significantly depending on several factors, including the tumor's size, location, and whether it has spread to other parts of the body at the time of diagnosis. Generally, the 5-year survival rate for localized osteosarcoma is around 60 to 80%, but this rate drops significantly if the cancer has metastasized. Follow-up care after treatment is vital to monitor for any signs of recurrence and to manage any long-term effects of the treatment. This may include regular imaging studies, physical therapy to regain strength and mobility, and psychological support to help cope with the emotional impact of the diagnosis and treatment. For patients and families facing osteosarcoma, finding support from healthcare providers, cancer support organizations, and peer networks can be immensely beneficial. These resources can provide not only medical guidance but also emotional support and practical assistance during a challenging time. In conclusion, osteosarcoma is a serious condition that requires prompt attention and a comprehensive treatment approach. Awareness of the symptoms, understanding the diagnostic process, and knowing the treatment options can empower patients and families during this journey. If you suspect something could be wrong, don't hesitate to reach out to healthcare professionals. Thank you for joining us today to learn more about osteosarcoma. Stay informed and take care of your health.